My name is Karen Taphorn, and I am a melanoma survivor. In 2011, I had a mole on the small of my back which started to bleed. I went to the dermatologist and found out that I had malignant melanoma. They surgically removed it, and we hoped that that was the end of the journey.
Melanoma is one of many types of skin cancer. It's actually one of the least common, but it is the most deadly when it does spread.
When I went for my 6-month scan, I was told that I had 24 tumors in my lungs.
Before 2011, the conventional ways of treating melanoma were largely based on chemotherapy. The median life expectancy was between 6 and 7 months.
When someone gives you a diagnosis of stage 4 melanoma, 1,000 things go through your mind. You just want to live.
When Karen came to us, we reviewed what was available in terms of approved therapies.
Dr. Jedd Wolchok was a Damon Runyon clinical investigator who we at the foundation supported to do early studies on immunotherapy. This was at a time when the scientific community was unsure about whether immunotherapy was actually going to be a viable treatment option for cancers.
We've now learned how to more precisely tune the immune system, increase the gain, if you will, so that the immune system might have a lower threshold for recognizing even small differences that the cancer has. The medicines that have allowed this to happen are what are called checkpoint blocking antibodies. These are medicines that essentially cut off the molecular brakes that usually keep our immune system operating at a certain level of function and allows the immune system to operate at a higher level of function.
The clinical trial that I was offered was a combination of 2 drugs. It was almost a 1-2 punch to attack the melanoma.
She went through the entire trial. She had no significant side effects and has had a durable, complete remission, which lasts until today, which is perhaps the greatest thing that I could imagine.
I remember the day that Dr. Wolchok walked in with the scan saying, "The tumors are gone," and I cried. And he said, "Why are you crying? You should be happy." And he was right.
Damon Runyon's support of Dr. Wolchok enabled him to take risks and continue to pursue research in areas of immunotherapy that were incredibly important to get to the point where we are today.
Taking risks is critically important in science. We want to make much more than incremental progress. We want to make transformative progress. And I think Damon Runyon always has its eye on the high risk, high reward balance. I was funded in the early 2000s when immunotherapy was not at all considered a safe bet.
Had they not done that, had somebody not believed in this idea, I wouldn't be here today. I take every day as a gift. When you think that your time is gone, it is amazing how brighter the colors outside look, how clear the air is, how pretty things are, and you truly see life in a different way.